Alright, prior to wrapping up, tell me your story you were going to tell at the start. The Doctor Chronicles part.
Yeah.
Fill in the gap, please. Thank you.
Yeah, fill in the gap. Can't remember which time. COVID stories. Like I think as a doctor, it was cases are increasing. I'm hearing on the news. I'm seeing Prof Witty talk about it, but I'm not seeing it in hospitals. I'm like, okay, is it just one of those things where cases are going up? You're vaccinated. You're not coming to hospitals because you don't need hospital. And then in the past 2 weeks, yeah, I've been seeing cases, man, and closing off some bays. And the two stories are, I had a young nurse, 29 years old, worked abroad as a nurse, but has come back to the UK to start working here, and double vaccinated, man, has got whatever variant she has of COVID, unknown, but super, super unwell. Like, this is a young person who is on the maximum amount of oxygen we can give her. Despite that, she's still breathless.
Wow.
Dropping her blood pressure because she's got... So, remember, you have the COVID, but you get complications of COVID, which are what generally...
You can get long COVID, isn't it?
Yeah, that's down the line. I'm talking about, bang, acute problems. So she had bilateral pneumonia. That's really hard to get, man. Pneumonia, chest infection, right? Both sides, same time. So both the lungs are compromised. And I'm like, this is just a healthcare professional. And it just hit me that day that, like you said, no one is immune. We don't know I always say to patients, I don't know how unwell you'll become because of this. There's no predictive.
There are no predictors.
No. It's, yeah, so that was that. And then the guy today, he's in a bay of 3 other people. He's in a hot area. They all have COVID. He started the day on 3 litres of oxygen. So to give you some reference, you and me, we have no oxygen on. Okay.
Mm-hmm.
Up to 4 litres of oxygen is like you can have a little, what we call nasal cannula, little piping. It's okay.
Yeah.
Anything above that, you need a face mask.
Mm-hmm.
Anything above 8 litres, you need a different face mask. And the maximum amount of oxygen we can give you on a normal ward, not ITU, a normal ward is 15 litres of oxygen.
Mm-hmm.
Okay, so maximum, it's a lot of oxygen. And he started then 3 o'clock. Junior doctor said, Jazz, can you come look at this guy? He's on 15 litres of oxygen. When we have that thing on the finger probe, the SATS probe, saturations, what we're measuring is your oxygen saturations in your blood. We aim for an oxygen saturation of 94% above. That's considered normal, right? When I see somebody who's on a lot of oxygen, the first question I ask is, does he need all the oxygen? Because, for example, I could put a probe on you, Indy, and it could show 98, right? Then I can give you 15 litres of oxygen, it's still going to show 98. So, although somebody's on the oxygen, I need to understand, do they really need it? So I just took it off.
Mm.
His number went from 91 to 69. And I was like, okay, this is really bad.
How quickly?
Not quickly, like a few minutes. And he looked unwell. I was like, all right, put the oxygen back on. Spoke to ITU. And they were like, yeah, we need to take this guy upstairs. But the thing was, again, and he's asking me, he's like, but they have COVID. How come they don't have this? But I'm like, that's it. It's just a spectrum. And then there's that. And then it's, why did you become so unwell in the course of today? You were fine at the start of the day, now you're not. Just is what it is.
Yeah. Beware of listening to people like Joe Rogan who say, oh, if you're ill, if you're tired, you're more prone to having really bad COVID. I'm like, yeah, you might be. But equally, you could just be fit and well, and then something could just happen to you where it just kicks in. It's not fair to say this one experience that happened to your one friend was something that kicked his ass, and that's it. It's not.
Yeah, you can't oversimplify.
You can't say that. You can't simplifying it massively. So beware of people that simplify things down, because one of our close friends, I don't know if we should say his name, but he had really bad COVID, very bad, life threatening, and I'm like, well, he's probably one of the fittest people that we know, and happened to him. It's like it could happen to anyone.
Exactly. So it's just an eye opener, and it's humbling because it's like you're never too far away, man. So be sensible, and be sensible. I mean, just like we talked about in this podcast about holidays and vaccinations, and just stop listening to shit and do your own research. Have an opinion.
Don't do your own research. Okay.
No,
listen.
Research,
no. Listen to the medical experts.
All right? That. Yeah. That
and
is
take their advice. Because you can find anything to back your opinion on the internet. I could find something on the internet right now that says pigs fly. I'm sure I could find some evidence of it. Okay? Genuinely, I could. It's too random a place. Listen to the experts, peer-reviewed studies, go with that. Boss, nothing else.
Listen to Indy, okay? Indy for Prime Minister, Indy for number 10.
I don't want to be PM. No,
Indy for Red Geordie.
If I was PM, yeah, this would stop. I'd be unhappy. And I'm sure there'd be some scandal out about me.
What would stop?
Away. This podcast would stop. I won't be able to do this. I can't talk freely.
Keep,
Actually, no, I'd be cancelled as PM within a week with all my opinions from this podcast.
Me and Sanj.
It's very simple.
Continue the podcast. It's okay.
It's very simple. I'd be finished.
Sanj and Doctor podcast. It's got ring to it.
It doesn't ring at all.
Oh, look at you! Look at you!
Who's going to edit your podcast, mate? Who's going to do the editing?
Oh, Riz! A promotion. Riz!
Who's going to do the anchor stuff? Who's going to do the Instagram posting?
Riz! You can still do
Who's
this,
going to
PM.
maintain it all?
Your aide. You know, as a PM, you get an aide, yeah?
Yeah.
Yeah, we'll get the aide to do it. That's fine.
No, Goran, I'm going to make you my aide.
Oh, look at...
Simple. I go down, you go down with me, mate. All right?